This is Julie Manoogian from LexMedia with another episode of Lexington Response. Today we're talking to a Lexington resident who is a healthcare worker on the front lines of the corona crisis. Her name is Dr. Jill Simon, and she's an emergency room physician at Newton-Wellesley Hospital. So Jill, first of all, we want to thank you and all the healthcare workers on the front lines right now. Obviously for safety, this is a Zoom meeting. Tell us, where are you Zooming from?
So I'm at work right now. I work in the Pediatric Emergency Department at Newton-Wellesley. We're actually in temporary space right now, so this is one of the smaller former adult areas that we've taken over for pediatrics to separate the kids out from some of the other sicker patients.
Is it fair to say the pediatrician ER physicians are being pulled over to the adult side to help out?
Yes, as best we can. My colleagues who are pediatric hospitalists, so who are used to taking care of pediatric patients up on the inpatient wards of the hospital, are also being pulled. So our pediatric unit at Newton-Wellesley is now a mixed unit. So there are some adults who are being admitted to that unit who are being taken care of by the pediatricians. And then there are some kids as well.
And how would you describe how things are going right now at Newton Hospital? Here we are in the middle of a surge. Do you have a lot of patients right now at the hospital in the ER with COVID that you are interacting with?
Right now, we're seeing in Massachusetts that it's seeming like we're at our surge volume. A high percentage of people who come into the emergency room are coming in now for suspected COVID. The majority of those people are older adults. So in my daily work, I'm not seeing the majority of people. We are expecting that anyone who comes in with a fever, which is a lot of what we do in pediatrics, that all of those patients are presumed to have COVID. So I would say right now about 50% of what I do is assumed to be COVID. Although that being said, when someone comes in with a cut on their chin, we're treating them as if they could potentially have COVID. So we're using the same protection for anyone who comes in.
And for those patients that test positive for COVID, are you giving them medication?
That's a little bit of a complicated question. So we're doing a couple different types of tests here at Newton-Wellesley. If we think that someone is sick enough to be admitted to the hospital, or if they need a procedure, a surgery that involves their airway, or if they're going to be sent to another facility, we're doing a COVID test that comes back immediately within, an hour or so. There's a whole larger group of people who are coming in with their flu-like illness who are well enough to go home. We are testing those patients for COVID. The turnaround time for that test is slower. There's really at this point no evidence to suggest that any medication that we send someone home with is going to treat their COVID. So those sickest patients who are being admitted to the hospital, yes, are being put on a number of different medications. The patients I'm sending home who I'm saying, you probably have COVID, whether it's a child, whether it's a young adult, I'm recommending what we would recommend for any flu-like illness. So lots of hydration, Tylenol. There's been some information that has suggested potentially anti-inflammatories like ibuprofen or Motrin may be harmful, although it's unclear. We're typically sticking to Tylenol at this point, and just other conservative measures we would tell people if they didn't feel well. Drink tea and honey and lots of rest and lots of fluids, and quarantine. So anyone who comes in who we think might have COVID has to go home and not leave their house. It can be difficult. I mean, a lot of people rely on leaving their house to go to work. And so this is part of the issue right now and why we're having to do this stay-at-home order, because we kind of missed it in some ways because everyone was out and about before they were symptomatic.
What is the process of testing and how long does it take to get the results now?
So it depends. If you feel like you have symptoms of COVID. So if you have a fever, or if your child has a fever or a sore throat or a cough, the first thing that we recommend doing is call your primary care doctor if you have one. A lot of the primary care offices, predominantly all of them, are doing telehealth visits. So they'll at least discuss your symptoms and make a plan as to whether you need to get tested. A lot of the pediatric offices are doing well child visits in the morning and sick visits in the afternoon. So they will actually see you. It's variable based on the different practices as to whether they're offering testing. We do have a respiratory clinic set up at Newton-Wellesley for kids and adults. So if your primary thinks that you need to get seen, they can help coordinate an appointment in that clinic, and then you can get tested, you can get an x-ray if you need to. Those turnaround times are within a couple days typically. We have a tent set up out in our employee parking garage, which is primarily right now for employees, but it's definitely opened up. The other option, what we do in pediatrics, is one of our roles is we're screening patients. So if for whatever reason primary care office was unable to coordinate getting a patient seen in a clinic for testing, they might send them to the emergency department. We have a quick triage system. So we check your heart rate, we check your oxygen saturation. You'll talk to the pediatrician, either on the phone or in person, and we'll get a sense of how significant your illness is. If you have no oxygen requirement, if you're speaking in full sentences, if you're clearly well, one of us from pediatrics will go out and see you, maybe listen to your lungs, and physically get you set up to go to the tent, and we walk you out to get tested. We will sometimes do the testing ourselves, but we're trying to minimize our use of our PPE. So the tent is set up and they're in their gowns and they're wearing them all day. And then if anyone comes into the emergency room and has any symptom concerning for COVID, whether it's a fever or a sore throat or feeling short of breath, then they get a swab. Whether or not it gets immediately resulted or not depends on a whole flow sheet of steps that I couldn't even begin to explain to you. I have to look at it every time.
And one of the burning questions that people have is, how is your supply of masks and PPE equipment?
So we're fortunate. Partners at Newton-Wellesley, we're part of Partners Healthcare. And in general, we've had enough supplies. Our definition of what supplies are has changed slightly. So, it used to be that you would go into a room with a patient who you thought might have the flu, and you would take a mask off the shelf. You would examine the patient, and then that mask would go in the garbage. That has changed quite a bit, and I don't know whether that will always be a change or whether we'll go back to what we used to go back to. So for instance, now when I walked in, I had to log on to the partner's website and say that I had no symptoms. There's a security guard out front. I showed them my pass, and then they give me a mask. This is my mask for my entire shift. We have another more protective mask that we also use for an entire shift that used to be single use only. So definitions have definitely changed as to what's appropriate PPE. But I'm lucky, I can go into any room with a suspected COVID, which is every room now, and I can put a gown on, I have gloves, I have a mask to wear. So we're fairly fortunate.
So Dr. Simon, would you say it's safe to go to the hospital or go to the doctor these days? I mean, if you're home and you have some other illness or something else has happened to you, something very different from COVID, should people be afraid to reach out to their doctors and come to the hospital?
That's a great question. I think the answer is 100% no. Do not be afraid to reach out to your doctor. We're here. Your primary care doctors are available, and what every medical professional is worried about right now is that people are staying home with other illnesses and putting them off, or are just afraid to seek medical care. As far as our hospital goes, and I can speak to, our emergency room, our process for triaging you, for screening you, and for getting you back to a room is very streamlined. 6 months ago, you come into an emergency room and the volume is so high you sit in the waiting room for 2 hours. Right now, because a lot of people are staying home and people are out of school, the volume is much lower. So if you come in with your child, as an example, who has been, sick with abdominal pain, you're gonna maybe get seen in the triage booth for 3 minutes, or more likely you're gonna be brought directly back to the pediatric area. Our policy right now is everyone is wearing a mask. When we go into a room, we're wearing gloves, we're wearing a mask. We are protecting not only ourselves from you, but protecting you from everything around you in the department. Our housekeeping staff is working triple time to make sure that our units are clean. So 100%, if you need to be seen, you should be coming in. What we worry about is a backlog in 2-3 months of everyone who has not been taking their own health concerns seriously, and then our system is overwhelmed from another perspective. So please call your doctor, come into the emergency room. We're here, we're set up to be able to see you safely. You're not gonna be in a room with someone who has COVID. You're not gonna be in a room where someone comes in coughing on you. That's what we've spent the past several months trying to do.
Okay, well, that's very reassuring. Now, I know that you are a native New Yorker, born and raised in Manhattan. As a New Yorker and as a physician, have you been studying what's going on in the New York hospitals right now?
Yes, I mean, what's going on in New York is incredibly scary. I think we're fortunate in Massachusetts in that we did not hit that critical that was hit in New York as far as resources, as far as numbers of cases. It's to be expected in a city that relies on a subway system. My mother's still in Manhattan, and she has been very careful about going out and getting groceries and even getting the mail. I have a number of friends who I've been in contact with who are in the hospitals in New York, and it's definitely intense. I mean, everyone's being asked to do more and sometimes different than what they're trained to do. But everyone from, nurses to doctors to housekeeping staff to essential workers, in grocery stores, it's amazing what New York has done to attack the illness. And it's looking like they're kind of peaking as well, if not coming to a decline.
In terms of staffing and being prepared, are you using what's happening in New York as a model for what might be coming here or is already here?
Yes, so over the past month to 2 months, we've been looking at not only other cities in the country like New York or Seattle, but also other countries like Italy to kind of give us a sense, not only from pediatrics, but from the entire hospital perspective as to what we need to do to accommodate. So we changed our staffing in the emergency department. For us in pediatrics, we're now working fewer shifts over the course of the month, but longer hours, partially because our volume is low, partially because we needed to be able to protect each other should one of us get sick. The hospital has been doing a lot of that as well. We've completely transformed parts of our hospital based on what we saw in New York and Seattle and Italy and other countries. So we have one floor unit that's basically an extra intensive care unit. As I had said initially, this area that I'm sitting in is not the pediatric emergency department. It's a smaller side area that had been used for a different purpose 3 months ago. Because our volume is low and because we wanted to shield the kids from the sicker patients, we moved to this smaller area. So rather than having 8 beds, currently I have 4. Other than that, the rooms are exactly the same. The wall's a different color. So we're all adapting. My adult colleagues have changed their shift hours as well. And we're in flux. We get emails every day as to what is the plan should we surge. So we have a whole other area of the emergency department and a whole other area of the hospital that we're ready to staff today if we need to. It's seeming like the emergency department hasn't had to surge their capacity in the same way that the inpatient part has, but everyone is ready to do whatever needs to be done.
The burning question I have for you is, whose face is on the pin that is on your hat?
So that's my face. So normally when I go into a room, this is what I look like. So kids can't see your face anymore. Neither adults can't either. So our child life team has made pins for each one of us, or whoever wants one, of our face, so that we can go into a room and someone can know what we look like. I have had more people say, "Who's on your pin?" than anything, which is kind of funny. So I come up with different stories about what friend is on my pin.
That's wonderful. That's amazing. That's the new normal now. Life is
Exactly. We also have our name on our scrub cap. Most people are wearing scrub caps to just minimize what we get exposed to. Normally, if I go into a room, I'm wearing a gown over my scrubs, so you can't see my ID and people don't know who you are. So this is a little bit of identification. I have safety goggles that have stickers all over them, you know.
Yeah.
Little clues as to how you know you might be being seen by a pediatrician.
Now, Dr. Simon, you are a Lexington resident, a mother of 2. Tell us, how do you keep your kids safe when you come home from work?
I avoid them, which is how I've kept them safe all along. So not much has changed as far as what I do. I've always been fairly careful when I come home from work to not be all over the kids. Fortunately, they're teenagers now, so they don't want to be all over me anyway. What I do and what a lot of my colleagues do is I have a pair of shoes that I keep at work, and I wipe them down. They're Crocs. I can completely disinfect them. After my shift, I change clothes completely. So I do not wear any of these clothes into my house. I have a bag in our little group office, and I change my shoes. I usually drive home in a t-shirt and shorts. When I get home, I take those clothes off, and they all go in that same bag that I kind of put aside, usually for a couple days. I take my shoes off that I wore out of the hospital, I put them in a corner, and then I shower right away. You know, we're fortunate there's enough space in our house that usually when I come home from work, I actually shower in a shower that no one else uses, and I sleep in the basement. I have not segregated myself from my kids during my days, but again, they're teenagers, so by nature, we're somewhat separate. I also have all of my stuff from work in a plastic supermarket bag that literally stays in the back of my car and then comes out, 4 days later when I work again.
So now let's talk about our town of Lexington and any safety messages you can give to your fellow Lexingtonians. Spring is here, the weather is warmer, we're inclined to get out there and walk. I know you live right near Lincoln Park. What kind of safety messages do you have for us?
You're feeding me to say the obvious. Wear your helmet, please.
Biking helmet, which has nothing to do with COVID-19. That's an everyday
right,
safety
exactly.
message.
Exactly. I am amazed at how many kids I see riding by without their helmets. I am the person who's yelling and saying, wear your helmet, wear your helmet. My kids are embarrassed to walk with me because they know I'm going to yell. And if it's someone I know by name because they were a classmate of my kids, I yell their name also. It's really hard right now. It's getting beautiful out. Our kids are getting stir crazy. We're getting stir crazy. And what you want to do is be outside and enjoy the beautiful air. I see lots of families walking around, which I think is incredible. What I would say is you really have to continue to talk to your kids and really kind of convince yourself. Just because we're in the surge and peaking, it doesn't mean that this is going to go away. We're going to be like this for weeks and weeks and weeks, potentially months. I'm a little disheartened when I walk around Lincoln Park and I see groups of kids still playing soccer, playing lacrosse, kind of cross-contaminating. Again, it's hard to know who's a family and who's living in close quarters. I think if you're walking with your family or walking alone, it's great to get outside. One of the things I would caution, speaking of helmets, is, crowded places. So you really have to be prepared and kind of tell your kids that it's okay if you have a plan to go walk on the Battle Green Road or bike the Minuteman. If there are tons of people there, turn around, go do something else. Maybe a week ago, I drove with my kids. We had gone and picked up some masks that someone had donated to my hospital. And I said, we're going to stop and we'll go for a hike. And we stopped to go for a hike, right outside Lexington and Waltham. And these two little parking lots and the streets were lined with cars. So I think people are very excited to get outside and enjoy the outdoors, but you have to remember that we're not out of this, nor do we know exactly when we're going to be out of it. I'm fortunate. I have a driveway and I have a basketball net in my driveway. And so we spend a lot of time playing basketball. We spend a lot of time walking. I kick the kids out and I make them stare at the outside wall as opposed to the inside wall. So really just keeping in mind of what's busy, what's crowded, and just staying away.
On a brighter side, are you seeing a lot of generosity and kindness at this time for healthcare workers?
Yes, it's incredible. And it honestly, every time someone reaches out to me personally or to our group or to our hospital and, we see postings about what people donated, it brings tears to our eyes. I had a good friend of mine, her daughter donated to us Girl Scout cookies, and someone else just texted me saying, I'm dropping by 12 boxes of Girl Scout cookies. There's this organization out of Bedford called Operation Feed the Soul, which is a group of residents, I think Bedford and Lexington, and they're donating money to keep restaurants in business and to feed frontline workers. So not just hospitals, police station, fire, the inpatient units, the housekeepers in every hospital around Boston, which is absolutely amazing. I've had more people donate masks, like neighbors donating masks and ordering me goggles and dropping them by. People through different Facebook groups sending supplies to just random physicians' houses. It's been absolutely amazing. And even just friends reaching out and saying, hey, someone I haven't talked to in a couple of years, saying, hey, I was thinking about you. How are you guys doing? It's amazing. One of my daughter's friends made me a mask for when I'm out and about and going to the grocery store. It really does bring out the best in people, and we're very thankful. I have a dozen cake pops sitting at my desk ready to deliver for this shift. So it's great. We're all eating too much, but it's great.
Well, we know that you're very busy doing very critical work, saving lives over there at Newton-Wellesley Hospital. We thank you for your time. We can't wait to see you around town when Lexington reopens again. What is it you're most looking forward to do in town?
Going to Starbucks and playing softball.
All right. Oh, do you play in Lexington?
I do. I play for Moms on the Mound, and although it's looking like our season will probably not happen this year, we are always looking for new players.
All right. Well, hopefully we'll reopen and you'll be out there playing soon.
So thank you for having me. I appreciate it.
Okay. Thank you. Take care. Be well.